This conference will now be recorded.
Good morning, everyone. Thanks for joining us. This is Whatcom County Health Department's COVID-19 media briefing for Wednesday, October 14th, 2020. I'm Melissa Morin, Public Information Officer for the Whatcom County Health Department. We're going to be hearing from our Director, Erica Lattenbach, this morning. Just a couple of reminders as we get started. Please go ahead and keep yourselves on mute. We will open things up for members of the media to ask questions once we've heard from Erica. At that time, you can go ahead and type your name and affiliation into the chat box, and we'll call on folks as those questions roll in. If you're unable to speak today, if you don't have a microphone, go ahead and type your question into the chat, and I will read those out in the order that they come in. And just a reminder, we are recording this, and it will be available shortly after the briefing, both on the Whatcom County Government's YouTube channel and on our media page at whatcomcounty.us/COVID. And with that, I'm going to go ahead and turn things over to Erica to get us started.
Thanks, Melissa. Thanks for joining. I do want to share, I plan to talk about sort of a potpourri of issues today. First, about our recent disease activity. Next, what we're finding from our testing site. I will also talk about safe Halloween options and the importance of flu shot. So with that, I will share a bit of information about our recent disease activity. We have found since the end of September that the case rates have been going down. They're on the decline, which is very encouraging, and just very, very appreciative of community efforts to remain diligent and continue to wear masks, staying a safe distance away from each other and limiting gatherings. That said, as we've seen over the course of the last 7 months, disease activity can change quickly, and we've seen declines followed by spikes before, so just to encourage continued diligence as we move into the fall and winter. Despite the good news in case rates overall, there are some notable exceptions for older adults. We have seen a spike in case rates among those 80 and over, and primarily this spike is connected to the outbreak at the skilled nursing facility that we've shared information with you about. So you can see on the graph, our numbers among those 80 and over have really, thank you, Melissa, for sharing that little hand there. So as you can see, the case rates have really spiked for 80 plus. We have also seen those 60 to 79 not seeing a decline. They went from below 25 per 100,000 over 14 days in early September to above that threshold in mid-September. As you can see, that is the blue line. We are continuing to see a range of symptoms among cases in Whatcom County. When we conduct our case investigations, the interviews with newly diagnosed individuals, we're hearing that headache, cough, and fever are frequently reported, but no symptoms stand out significantly among other. So it's important, just as a reminder for everyone, not to self-diagnose based on your symptoms. Or to use them to rule out whether or not you should be tested for COVID-19. If you have symptoms at all, we encourage you to be tested. On a related note, we do have some information that our epidemiologist shared this week, and I thought would be helpful to share with all of you. I think it's just an interesting snapshot of what we're seeing in terms of our testing site. This is not inclusive of all of the testing sites as a whole in Whatcom County. This is really just the Whatcom County Health Department and Whatcom Unified testing findings. So among all tests, there was a 1.5% positivity, and that's pretty consistent with the overall percent positivity countywide, not just from our testing. But I think once we start to dig in on some of the risk factors, like a known contact of an existing case, someone who's been diagnosed, or reporting symptoms, that's where things start to change and differentiate. So I'm going to just direct you to actually the bottom line of this table, which is if someone is a known contact of a case and they've reported symptoms, we're finding that almost 13% of those individuals test positive in our testing site. Whereas if you think about the opposite of that, which is no symptoms and no contact reported, it's 1 in 1,000 people that are testing positive. So we do see that having contact, having symptoms are risk factors and certainly warrant being tested. We do recognize that some of these individuals who are testing, who may not have a known association with a case or no symptoms, may be testing for a medical procedure, travel, especially to Alaska, or other reasons that require them to have a test. So we do recognize that that is a factor for individuals. But I think, again, it's really just important to note those two ends of the spectrum. For individuals with a known contact and symptoms, very high percent positivity, which is expected. But for those with no known symptoms and no contact reported, the numbers are very, very, very low. That said, people with symptoms, people with a known contact, certainly encourage all of them to be tested. And for those of you who have not seen our testing data on our website, I just do want to share that the Whatcom County COVID website in our testing section has a tab that allows you to see this data by week, not by symptoms, but by the number of tests, the number of negative results, the number of positive results, and the percent positivity. We dug in a bit more for the purposes of this media briefing to give you a bit more data on that, and certainly happy to share any of this that I've been peppering you with. So next, I want to move on and talk a little bit about safer Halloween celebrations. And just kind of start by saying that, while this year has challenged our community in so many ways, we can celebrate differently while honoring our traditions and our important holidays. And I know for some, Halloween is one of those important holidays, especially for our kids. We encourage folks to avoid higher risk Halloween activities like Halloween parties or door-to-door trick-or-treating. We do encourage individuals to celebrate outdoors with a small group or find creative low-risk activities you can do at home, like a virtual costume contest or other fun activities. We've seen spikes in our cases after previous holidays, and because our case rates have been declining, we do have concerns that the Halloween holiday could result in future spikes, and so we really encourage people to celebrate safely. And I will share as well that one of the silver linings of this year has been to develop closer partnerships with our businesses and our business associations, and to help support businesses reopening, staying open, addressing cases and spread within the businesses. And our partnership with the chambers has been really helpful in encouraging good messaging and compliance among businesses, but also just creating a good environment where we feel as though health and the economy can be addressed together in partnership rather than being pitted against each other. And that said, I just want to say that it's been really great to see that downtown business associations and chambers have developed fun no-touch Halloween celebrations, and we've been involved in looking at their plans and really feel like they've taken the creative celebrations to a new level, and we're excited to support that and encourage those kinds of celebrations. So that's been really great. I want to reiterate the importance of the flu vaccine. It's really important, especially for this year, that people get their flu shot now as early as possible. The reason why it's more important this year, it's important every year, but it's really important this year because one of the metrics that we track that's really important for our ability as a community to move through COVID is our hospital capacity and the strain on our healthcare systems. And when people have severe illness from the flu, they may go to the hospital, thus further sort of stretching our healthcare resources. Also, the comorbidity of both the flu vaccine and COVID are very concerning to us. Someone who is experiencing the flu is more susceptible because of their weakened immune system to COVID illness and potentially severe COVID illness, and those together form a really sort of dangerous combination for individuals as they recover. The Whatcom County Health Department is planning for implementation of a flu clinic or partnering to ensure that the access for vulnerable populations, and that's really our focus. But as many of you know, flu vaccines are widely available at pharmacies, at doctors' offices, and other healthcare settings as well. We are focused on the vulnerable population as we are concerned about those comorbidities and severe illness. I want to close by just restating again that COVID is real. It is damaging. It is highly contagious and can cause long-term pulmonary, cardiovascular, and other severe conditions, as well as extended illness and death. And we've been hearing from some of our elected leaders that it's not something to be afraid of. And it is a real threat to our community that we need to take seriously. So again, just encouraging folks to gather safely, get tested, and keep wearing your mask. With that, I am happy to answer questions that you have.
Thanks for that, Erica. We're going to go ahead and open the floor up for questions. So again, members of the media, if you would like to ask a question, go ahead and type your name and affiliation or type your question into the chat. And I'll just call out for folks, we do have some information about Whatcom County Trip or Treat, and there's a link there in the chat to that for more information, referring to some of those partnerships that Erica was calling out with our business community. So thanks for sharing that. For folks who aren't able to see the chat and are viewing the recording, that URL is https://whatcomtriportreat.com. Not seeing any questions come in for the chat, so we'll just pause a couple more minutes and see if we have any questions roll in.
And Melissa, we can share some of that testing data with folks following this as well, right?
Yeah, absolutely. We can make some of those, the graphs that aren't available, we can make those available to folks after the call as well.
Great.
We've got a question here from Alex with the Salish Current. I've been researching false negative rates at all levels of government. It seems that nobody has immediate access to the data regarding short-term returns with positive results. I've been hearing things like how the data isn't held in a way that's possible to analyze. Is that true?
I guess I'm not totally clear about your question, but there are different testing technologies that are more sensitive and specific. So sensitive as in the ability for a test to show a true positive, and specific, the ability of a test to show a true negative rather than a false negative or a false positive. The PCR test that we use through Northwest Labs is at this point the gold standard for sensitivity and specificity, and we feel confident in that. There are other technologies, for example, the Abbott point of care test, and that has had some challenges with its specifically its sensitivity, and it has resulted in a follow-up PCR test in order to confirm the results. But the testing that we're doing broadly as a community in partnership with Northwest Laboratories is using that PCR test, which is at this point the most accurate test that we have.
Thanks, Erica. Our next question is from David Rosbach with the Bellingham Herald. David asks, can you provide an update on the response and the latest data on the outbreak at Highland Health and Rehab? Can you tell us how many cases are still active at the facility?
Sure. Yes, this has been such a tragic and challenging issue for this community, and I know the staff have been working really hard there in partnership with both the health department staff, our health care response team, and the state agencies that regulate and work with them. At this point, 38 of the 40 residents are positive. 18 of the 60 staff are positive, and we have had 10 deaths at that facility. So among those 38, there are 28 surviving residents. That said, the facility is testing residents and staff, those that have not tested positive yet, every Tuesday and every Friday, which allows us to rapidly address any new cases. And we have a daily call with them to check in on how things are going and how the staff and the residents are doing. I couldn't tell you decisively how many of those, of the 28 among the residents and the 18 among staff have resolved, but we can certainly follow up with that.
Thanks, Erica. Our next question is from Robert Mittendorf with the Bellingham Herald. Can you say where you are seeing spread, for example, offices, retail situations, private interactions, or parties?
Yeah, it's it's a mix. It's all of the above. I will say in office settings, the places where we're seeing spread are non-public facing areas, for example, break rooms where staff are sharing lunches or eating lunch at the same table. Obviously, you can't eat with a mask on, so unmasked, even small gatherings of a few people. We're also seeing, and there's risk in staff taking smoke breaks together, where they're again not wearing masks and are in close proximity. I think this is particularly true on days when it's raining and staff are trying to get under cover and under the awning and there's not a lot of space. We've also seen cases in workplace settings among staff who ride together in a company vehicle or another vehicle and not wear masks. So again, it's the nuts and bolts. It's not wearing a mask and it's being in close proximity for over 15 minutes together. In terms of private interactions and parties, there haven't been any large or noteworthy parties or gatherings that, much like what we talked about earlier in the summer, the 150 people at a party and 30 were infected. We haven't seen anything like that in the last month or so. We do continue to see household spread, and that's another risk factor, of course, and one of the reasons why we have that isolation and quarantine facility available. So if people can't safely quarantine or isolate at home for fear of infecting family members or children, that they have a place to go so they can recover and move past their quarantine or isolation period. So it's kind of a mixed bag. There isn't one thing I can tell you that that is the point of spread or the main source at this point. It's a real mix.
One thing I'll add in addition to what Erica's described is we can't necessarily always parse out transmission for folks who are who gather socially, but who may also work at the same business or facility. It's impossible to necessarily identify specifically where that spread may have happened, and certainly a lot of people become friends with their coworkers and spend time outside of work together as well. So in some of those situations, it can be difficult to assess whether or not that's happening in those public spaces or employee spaces and businesses, or in those private interactions.
Yeah, thanks for that. And just the nature of this spread makes it more challenging. I remember when I was in grad school and we in an epi class, and we were talking about a foodborne illness and trying to identify the source, and it was always the egg salad that people shared and made them sick. Well, there is no you know, smoking gun of what the source of the spread is. It's really those the close proximity, not wearing a mask. Because this is airborne and not foodborne, it's much more difficult to identify and be able to pinpoint how exactly a person has been infected. That said, I don't know if there were any other questions, Melissa.
No, it looks like that's the end of the questions. We'll do one last call for questions. If you have one, feel free to go ahead and unmute yourself to ask it. Otherwise, we will wrap things up for today.
Hey, is it all right if I ask a follow-up question about the false negative thing? To kind of explain a bit, my research has mostly been around finding the false negative rate, and meaning that someone who tests once is negative and then tests positive a couple of days after, which is inherently a soft statistic. But from what I've been hearing from people, including Northwest Labs, is that there's using the PCR test around a 10% false negative rate, even if you know, you test 3 different sites in the same person, and 100 people, around 10% of them will probably be infected, or show as not infected, sorry. I guess I'm kind of curious about how the data is stored in such a way that finding that rate is difficult, is what I've been hearing. That like the data isn't stored in such a way that it can be calculated, I suppose.
And by data, I just want to be clear, by data you're referencing a negative test followed by a positive test. Correct. In an individual. So this is something that the state has been working on in partnership with the locals to try to identify, and one of the reasons why about a month ago there was a change in the way testing was reported. And so instead of calculating every test, which could be multiple tests in an individual, one person that maybe tests negative, positive, that gives us the wrong sort of denominator. And sorry for others if this is getting too far in the weeds, but it gives us the wrong denominator because we're not actually looking at the total population. We're looking at a population that falsely shows a larger percentage of, because you have individuals that test multiple times, right? And so they changed their formula, so it would be based on the individuals that test positive and negative versus the number of negative and positive tests. So at this point, we don't have a good way statewide to track what you're referencing, which is how many people are testing negative, positive, or a negative test and then a positive test. The way that we look at the data is based on different types of tests. So that Abbott Lab point of care test, with a positive test, it's only identified as a probable case, and then we follow that up with a PCR test to determine whether that's a confirmed case. But we don't do that. We don't do that intermittently throughout the PCR tests. We only do that as a function of the two different tests. So does that sort of start to get at your question?
Yeah, that's very helpful. Thank you.
Okay. Okay.
Thanks, Alex and Erica. We have another question here from Julie Shirley with the Bellingham Herald. Schools elsewhere are sharing with the public when there are cases. With some Whatcom schools starting this week, can you share details about how you are working with Whatcom schools?
Sure. We are working very closely with Whatcom schools. We also have an education and childcare response team, which is comprised of our public health nurse that works with child cares even in her non-COVID day job, and an environmental health specialist that also works with schools and in other ways. So they've been working closely with the schools on technical assistance, plan review, etc. And our health officer, Dr. Stern, has been working closely with the superintendents on policy and thinking about what makes the most sense in terms of sequencing for reopening and how we'll manage cases broadly. We're appreciative of the Bellingham School District for kind of taking the lead on behalf of all the public school districts in the county in developing standards with our team and protocol for how to handle cases, how to cohort students, etc. So we feel very confident that our school districts are prepared and ready to go, and it's really just a matter of managing what comes next and making sure that they're supported and have the information they need to be able to reopen safely.
Thanks, Erica. Julie has another question asking if we have information about the incidences of multiple tests for one person. People have asked how often they can be tested. And I did just clarify with Julie that that question is about insurance coverage for multiple tests.
Yes. I don't have that off the top of my head, how many individuals have tested multiple times. We are concerned that for individuals who test without symptoms or without a known contact and they test repeatedly, that we have heard reports of insurance denying those claims. So I think there's a balance to strike between risk and probability and frequency in testing. But we don't work directly with insurance. Northwest Labs works directly, so I don't have all of the details about how many claims that they've had that have been denied. The health department is not involved in the financing or reimbursement or insurance billing piece of this. However, that said, we are planning to set aside some of our CARES Act dollars to help those who may have their insurance denied, so they don't have a barrier in receiving a test.
Thanks,
Melissa, were you going to add that?
There may just also be information, from the State Office of the Insurance Commissioner in terms of insurance coverage for COVID testing. I think that may be the end of our questions. I am just going to hang on here for 1 minute in order to drop in a link to our health officer's recommendations for schools. We've posted the recommendations that he shared with school superintendents, public school and tribal school superintendents and administrators, as well as with private schools throughout the county. So I'm going to go ahead and drop that link into the chat here for folks who are interested. And with that, I think that we can go ahead and close things out today. Thanks everyone for joining us, and we'll look forward to giving you some updates in a couple of weeks.